So namaste. Good evening, everybody. Hope you all are having a great day and doing well. I am Dr. Dhanya, Senior Medical Officer of Kerala Ayurveda Limited and co-host for today's session. We are truly delighted and honored to have you all with us. Just a few house rules before we get started. Only the first 1,000 participants will be able to view through the Zoom link, and the others can watch the live stream through our YouTube channel. For an uninterrupted listening, we have turned off the video cameras and muted all the invitees. If you have any queries during the webinar, please convey it through the Q&A, which you can see at the bottom of the Zoom panel. Thank you for your cooperation. The schedule of the webinar will focus on Ayurvedic clinical approach to diabetic complication with a renowned speaker. Now, I would like to request Dr. Anil Kumar, our Executive Director, to have the welcome note. We are excited to meet our honorable speaker and moderator for the session. Over to you, sir.
Thank you, Dr. Dhanya. Namaste to all of you and a very good evening. Today is our 9th series of Kalpam Talk conducted by Care Foundation, which is promoted by Kerala Ayurveda Limited. Today we are very lucky to have Dr. S. Gopakumar as the faculty, a renowned and very famous faculty and the right person to deal with the subject. And today's subject is Ayurveda clinical approach to diabetes complications. So as we all know, this diabetes is a growing challenge in India, not only in India, throughout the world. And with an estimated number of around 463 million people are now diabetic. And out of this, around 77 million patients are there in India as diabetic patients. So if we go through the statistics, some of the numbers I would like to share with you. Everybody say that India is the capital of diabetes when we compare with other countries. And also in that, Kerala is the capital of diabetes in the states. So that is a status. And if you see now, around 20% in India, the population is so around 9% is diabetic, and it is growing very fast. Many reasons are like lifestyle issues, diet, exercise, stress, tension. Many things are there, which Dr. Gopakumar will be explaining all those things. I'm not going into that in detail, but the major problem is this 77 million people in India may grow in another 10 years to 125 million. That is the statistics on diabetes. So that is a very alarming situation. So how we can control this? And basically our subject today is more on complications. There are many complications. The major ones are, everybody, doctors know that neuropathy, nephropathy, all kind of pathies, including retinopathy. Then major complaints are, there like many nervous diseases. Even it may affect the mental faculty in the long run. And Ayurveda can contribute to many ways for these complications. We all generally believe, and it is, and we have experienced also that, if we have Ayurvedic medicine, the complications or this kind of issues can be delayed, and so that people can, people with diabetic disease can have a healthy living in their future if we have their Ayurvedic therapies and treatment. So that is a major important part on Ayurveda with diabetes. So anyway, Dr. Gopakumar, we are honored to have Dr. S. Gopakumar here to dwell on this subject. I'm not entering into the details. And Dr. Gopakumar needs no introduction. He is a very famous doctor, very accepted not only among the senior generation, also the younger generation. He's a, the students are looking forward for his talk always. So we had very good experience last webinar. We had more than 1,600 participants when Dr. Govumar came in for the first time with us in this webinar. So that was more of COVID time, so people were available there. So Dr. Govumar presents gave us great numbers of participants. He needs no introduction, but still I would like to dwell upon or share some of his great achievements. He was awarded Best Teacher Award in 2020 from Kerala University of Health Sciences, and Amrita Mitram Award for contribution in public health again in January 2020 from Manas Charitable Trust, Trivandrum, and Maha Kaivalya Puraskar for contribution in Ayurvedic education by Asha Foundation, Bhubaneswar. Pride of Ayurveda title in connection with National Ayurveda Day by Ayur Central Foundation, Bangalore. Kanji Mahaswami Puraskar by JSS Ayurveda College, Chennai. Maharashtra Samman Puraskar by Maharashtra Ayurveda Students and Doctors Association. Tilak Ayurveda Award, Dronacharya Award. I'm not going to the details, but mentioning some of the above. Nima Gaurav Puraskar, Acharya Award of some of the famous prime awards are Acharya Award of Central Council of Indian Medicine, Department of Ayush, that he got in 2017. Selected as a Best Ayurveda Teacher by CCRIS, Department of Ayush, for the first National Ayurveda Day on October 28, 2016. Selected as the Best Ayurveda Teacher of Government of Kerala in 2014. That award is called Atreya Award. There are many, I think I have with me 2-3 pages, so I am not going to read all those. He is so famous, so very good scholar. Everybody knows that, so I'm not going along with all his credentials. His credentials are 4 or 5 pages with me. So we are lucky enough to have Dr. Govumar as the faculty. And thank you, Dr. Govumar, for accepting our invitation. And we are looking forward to your talk. And thank you for accepting. And now we can we'll request you to go to the subject. So we'll start with the webinar subject. So I invite Dr. Govumar to start the seminar. Thank you.
Thank you, sir. Thank you. Thank you all. Good evening to all. So the topic for the evening is Ayurvedic clinical approach to diabetic complications. We very well know the topic is not simple. The disease impact is not simple. The severity is very much high. It is not easy to manage every cases of diabetes by Ayurveda, but there are certain areas where time-tested Ayurvedic clinical approach can bring very good results in patients. So I will be sharing some of my experiences. There are so many areas in diabetes complications, so I will be touching some important area within the allotted 1 hour. Let us go to the topic. Everyone know diabetes mellitus can be due to basically 2 pathology. Next slide, please. The basic pathologies are insulin resistance, and there can be destruction of the beta cells. So we very well know there can be absolute deficiency of insulin. This absolute deficiency of insulin is very much similar to the Dhadushaya stage, and insulin resistance is very much similar to Avarana stage in Ayurveda. So my dear friends, my humble request is, even though you are having all the available laboratory investigations, including the glycated hemoglobin, RBS, PPBS, everything, you have to assess what can be the possible samprapti behind the prameha when the patient is in front of you. So the treatment for the Dhadushaya prameha and Avarana prameha may be different. So if it is an autoimmune mediated destruction of the beta cells of islets of Langerhans, definitely there will be signs of Dhadushaya. Dhadushaya pramehas are very much similar with the Krisha pramehi, and the dosha domination may be Vada. But Avarana prameha, the patient may be obese, Sthula pramehi, and the dosha may be Kapha. So we should be able to identify these 2 clinical stages in addressing the issue. Next slide, please. Disease profile as per Ayurveda, and just giving an idea to see what is actually diabetes in Ayurveda. Imbalance of Dhatogini, very important point, because the multiple complications occurring in different organs are due to the impact of an impaired Dhatogini. It can occur in the eye, it can occur in the kidney, it can occur in the limbs, it can occur in the heart, it can occur even in the Uttamanga. So the impact of Dhatogini is very much important. Now all the hormonal fluctuations which we are coming across with the diabetes mellitus can be comfortably placed under Dhatogini Daurbalya or Dhatogini Vaigunya. Then there is no doubt that there is Bija Dushti, there is a genetic component is always there. And it is always aggravated by Ahara Vihara, because we very well know the lifestyle factors are directly influencing the pathophysiology of diabetes mellitus, and everything will be resulting in Kleda Vriddhi. That is important. When we discuss about Prameha, the important or the cardinal pathological word is Kleda. What is Kleda? In Kleda, what is happening? The blood vessels will be obstructed. There will be gradual Mala Sanchaya. The Malaruba Bhava, which is very much related with the Jala Mahabhuda, is Kleda. And you know, Mutrasya Kleda Vahanam. Mutra is doing the unique function of removal of the Kleda. So when the Kleda is increased in the body, definitely the Mutra Vaha Srodhas will be having more load, and the Kleda Sanchayam can be leading to multiple complications. So in my humble opinion, most of the complications in diabetes mellitus are due to Raktavaha Srodho Dushti and Medovaha Srodho Dushti. We very well know the vascular component of the body with the Raktavaha Srodho related pathologies are there in one side, and the other problems related with dyslipidemia, metabolic syndrome, type 2 diabetes mellitus, obesity, central obesity, all are running behind the Medovaha Dushti. So my dear friends, the combination of Raktavaha Srodho Dushti and the Medovaha Srodho Dushti are the main events which are leading to different types of diabetic complications. So these are the points which we have to keep when we address individual diabetic complications. Next. If so, whatever I told, if so, is it a Mahagada? No doubt. We study that diabetes is a Mahagada, one among the Ashta Mahagada. Why? It is very difficult to cure, Acharya directly tells, because gradual involvement of all the three dosha. So I always tell my students, or I always tell to myself, if you want to learn what doshas do in the body, please study Prameha. Because the Prameha may start with a Kapha domination, an obstructive occlusive phase, then it can go to a Pitta domination where the Rakta Dushti, vascular involvement, diabetic dermopathy, everything will come. And finally, Prameha will go to the Vada stage where even the ojas can be considered as a Dushya, and diabetic neuropathy, diabetic amyotrophy, Shosha, Shula, everything can occur. So actually we can tell that there are three types of Prameha based on Kala Samprapti. The same person may be in the first stage in Kapha stage, then he may be going to the Pitta stage, and finally he may reach a Vadika stage. Multiple Dushyas, that is very important point. According to Charaga, 10 Dushyas are mentioned. What do you mean by Dushya in Prameha? In practical sense. In practical sense, multiple Dushyas means you will be getting different points in the body, different organs in the body where there can be Sthana Samsrayam, where there can be Dosha Dushya Sammurchanam. Say for example, when the doshas locate in the Amashaya, there will be different clinical manifestations in Prameha. When doshas localize in Rekta, there can be all the Prameha Pitaka, etc. When doshas are with the Medo Dushti, there can be Adisveda, obesity, etc. When doshas are seated with the Mamsa, there can be diabetic gangrene, diabetic amyotrophy, Mamsa Shosha. And when doshas are located in Shukla Dhatu or other things, there can be diabetic related erectile dysfunction. So what I am telling, multiple Dushyas are there. So my dear friends, the primary responsibility of a classical clinician in Ayurveda is to identify the stage of the dosha of your Prameha patient. The next thing is identify what are the Dushya, what are the tissues, what are the systems involved at that particular point of time. I think it is clear. So these two things, the dosha, Dushya, Vibhajanam is very much important other than the normal routine diabetic investigations. Okay. Then involvement of Vasti Mahamarma, Vasti Mastritya Kurude, Pramehan, Dushti the Kapha. Vasti can be considered as the entire renal apparatus. So there can be diabetic nephropathy. There can be multiple issues of renal failure. So Vasti Mahamarma is very much important. Chirakarita, Prameho, Anushangina. The chronicity of the disease is an important factor because any Chirakari Roga, any disease which is having a long course in the body will be definitely affecting all the three Roga Marga. This is a very important point. In Bahi Roga Marga, you are getting diabetic dermopathy, Prameha Pidaga. In Abhindra Roga Marga, you are getting internal Koshtangas involved. In Madhyama Roga Marga, you are getting the Vasti, Siro, Hridaya, Marmas, and even the nervous system. So all the three Roga Margas are involved due to the chronicity, Chirakarita. Then no doubt it is Kulaja Vigara. And next point is Ubadrava, our topic. It is notorious for complications. Subhadravas means complication. So everything put together, the disease is becoming Duschigilsya. So there is no doubt that Acharya how or why he put it under Ashtamahagata. Okay, next. Next slide, please. Now let us come to the topic. Diabetic complications. We can see a pie diagram where you are getting all the ideas. The maximum number of complications are related with the cardiovascular disease. The vascular system is mainly affected. Nowadays, we can call diabetes mellitus as a disease of blood vessels. When there is a problem in the small blood vessels, we call it as microangiopathy. When there is a problem in the bigger blood vessels, we call it as macroangiopathy. So ultimately, the vessels are very much involved. That is why the incidents are more with the cardiovascular disease. Then there is a significant contribution from renal disease. We very well know the diabetic nephropathy and ophthalmic disease, diabetic retinopathy, which may be proliferative diabetic retinopathy or which may be non-proliferative diabetic retinopathy. And one of the important cause for blindness in India is also related with the diabetes. And there can be neurological disease. Neurological disease can be the peripheral neuropathy, autonomic neuropathy, and even there may be the chances of developing stroke in diabetes patients. And the peripheral vascular disease, very, very important, Rektavardavada or Rektavaha Srodoroda, which may be leading to peripheral limb ischemia. Peripheral limb ischemia, and which can further lead to diabetic foods, diabetic ulcers, and even result in gangrene, or finally even amputation. So you can see all the three Roga Margas are affected by Ubadrava Roga or complications of diabetes mellitus. Next. Then what is the clinical approach? If you are getting all the so-called clinical involvement, then how we will make a protocol? What can be the approach? That is the topic which we are going to discuss today. Identify the dosha domination of Prameha. That is mandatory. Irrespective of getting all the postprandial blood sugar value or glycated hemoglobin value, assess your patient is in Kapha stage, Pitta stage, or Vada stage, or in between Kapha to Pitta, or in between Pitta to Vada. This is very much important. An occlusive pathology in Kapha, an inflammatory pathology, vascular damage in Pitta, and a degenerative pathology in Vada. All the three need different treatment protocol. That is why it is very much important. Then assess other Samprapti factors. Not only the Prameha, there are individual diseases involved. Say for example, when you are getting a diabetic nephropathy, what is happening? The glomerular filtration rate is coming down and there is Kleda Sanjayam, serum creatine, blood urea, nitrogen, urea, etc. will be increasing and they will be behaving as AMA. Then there will be renal failure. So you have to think about that particular Srodhas also. Then treat basic pathology of diabetes mellitus first. You have to give all the treatments which will not be only bringing down the sugar value. You have to do some treatments which will empower or strengthen the adjacent organs which can be affected in the future stage. An intelligent Ayurvedic Vaidya will anticipate such complications when he start treating the diabetes patient. So he will be naturally empowering the vrukka, naturally empowering the blood vessels, naturally empowering the eye. He will tell the patient to avoid all the ajashushya ahara vihara. I have so much of experience. Some patients are coming with only visual problem because they may be having ajashushya ahara vihara in their lifestyle. Some people will never develop a problem in the eye. They will be developing a kidney problem, maybe due to the medo dushti, medo vahanam srodosam brutko moolam. Some people will be developing only peripheral vascular disease because they will be having Rektavardavada, Vidahinnam, Viruddhanta, Tattachastra Pradushanam pathology. So identify the Srodhas which can be involved or which is involved, that is to be a basic point. Next step, go to the Vyadhi Pratyanika Chikitsa according to the nature of the complication. This is what I have to stress. Vyadhi Pratyanika Chikitsa means the disease specific treatment against a particular complication. I will tell one simple example. When you are treating a case of diabetic retinopathy, you very well know eye is a vascular organ. Chakshus tejomayam. So a organ which is tejomaya will be easily damaged by kapha dosha. And unfortunately, prameha is a disease started by kapha. You very well know Asya Sugam Soppan Sugam Devini Gramyudaganu Barasapayamsi Navannapanam Gudavaigradamja Prameha Hedu Kapha Kricha Sarvam. So when you are getting a Sandarpana Pramehi or type 2 diabetes mellitus, there will be an important role of kapha pragopa in that patient, and this kapha with the mandaguna, snigdaguna, slashnaguna, guruguna will definitely impair the agni, and that will be reflected in the pittasthana, agnisthana, tejosthana, eye. So he will be getting all the retinal edema, retinal obstruction, retinal hypoxia. So impact of kapha related srodoroda in koshta will affect the datogni. The impact of kapha related properties will affect the tejo, the eye. So you are getting diabetic retinopathy. So this is the way to analyze how each guna vigalpa can affect diabetes as a swadandra vyadhi, and each guna vigalpa can affect other complications as a paratandra vyadhi. So that is very important. Another example I will tell you, when you are getting a diabetic peripheral vascular disease, definitely there will be a role of the peripheral blood vessels and rektavrta vada. Let us go to the Vadarekta context where beautifully it is mentioned. Rektamargam Nihandyashu Shaga Sandishu Maruda Nivisyam Anyonyam Avarya Vedana Praharatyasun. So you have to combine the treatment of Prameha plus Rektavrta Vada. That is what I am telling. Go to the Vigalpa Samprapti as per the Vyadhi affected, and always focus on Yogi Bala. That is important because day by day the patient will be losing Bala. Because Prameha is a progressive disease with definite elements of Dadu, Daurbalya, Dadu Shaidilya, and Dadu Shaidilya, if there, definitely Dadu Sarahinada, Ojohani, and Bala will be affected. You may not be able to do the classical Vastikarma if the Yogi Bala is compromised. So the best treatment can be done to that patient who is having the best Yogi Bala. So always keep an eye on the Yogi Bala. These are the basic inputs which I have to share you before we go to the deeper concepts. Next. Key points, special attention to the Rektavaha Srodas and Medovaha Srodas. My dear friends, there is a problem here. It is very easy to tell that there is Rektavaha Srodas and Medovaha Srodas. See, Rektavaha Srodas is always related with Ushna Nidana. Vidahin Annabanani Snigdoshnani. But when you come to Medovaha Srodas, it is very much related with the Shida Guna. So Ushna related Rekta, Shida related Medos are having certain opposite property in their Dushya domain. So the possibilities of a Viruddha Upakrama can be there. So you have to select the common treatment which will not disturb the Medas but which will pacify the Rekta Dushti. That is very important. Rekta Mosha is very important, especially Jaloga Vidarna is important. Tiktharasa drugs are very much important because Tiktharasa drugs will definitely cause Rekta Prasadana and they will be causing Medo Shoshana. I think this is very important. When you are getting a basic Prameha Rogi with obesity and Medo Dushti, with an Anubandha Vyadhi, Ubadra Vyadhi of Rektavaha Srodas, Tiktharasa drugs are important. Buduchyadi, Nimbadi are very important drugs. Buduchyadi, very well know, Buduji is a drug which is very well indicated in Vadarekta. And you know, when there is a Shakhagada Vadarekta, when there is a Rektavrta Vada, Buduchyadi is important and it is very good in Kapha Pitta. Buduji, Patmaga, Arishta. You see Patmaga, Arishta. Arishta means Nimba. Nimba is with the Tiktharasa. And Buduchyadi is generally Tiktharasa and it is very good against Medo Shoshana and it is very good for Medo Shoshana and Rekta Prasadana. So think like that. Nimbadi Kashayam. Nimbadi is again Tiktharasam, it can Medo Shoshanam, Branaropanam, and it can definitely minimize the microbial growth associated with the peripheral limb ischemia. So identify the Guna Vigalpa which is applicable to both Mukhya Vyadhi and associated disease. This is what I have to stress throughout this presentation. Hope you are understanding the meaning. Okay, next. Next, what is vascular endothelium? When I am telling about the Rektavaha Srodas, I wanted to make it more clear in terms of modern pathology. Vascular endothelium is the inner lining of the vessel wall, innermost lining of the vessel wall. And vascular endothelium releases mediators that are important to maintain homeostasis in blood vessel. In very simple word, I can tell you, the healthy endothelium inside the inner lining of the blood vessel will tell how much an artery should dilate, how much an artery should contract. So, Sravana Srodamsi. Dear friends, I am telling a unique concept. We always discuss that Srodasi, Sravana, Srodamsi. But the very good explanation is there are certain chemicals secreted by the endothelium which will enable the functional and anatomical status of the Raktavaha Srodas. So you can proudly tell that the definition told by Charaka centuries back, like Sravanad, secretory, is very much applicable to the vascular endothelium, which is having secretory function, which itself will be responsible for the functional integrity of the concerned vessel wall. So vascular endothelial dysfunction is an important event which can trigger diabetic complications. So my point is very simple. Even though patient is developing the diabetes mellitus, if he is undergoing Vidahi, Nannapanani, Snigdoshnani, Dravanija, etc., there will be much more possibilities of developing endothelial dysfunction. Then there can be definitely microangiopathy, macroangiopathy. Yatra Sangha Khave Gunya, Vyadis Tatrobajayada is very much applicable as a triggering pathology related with the blood vessel diseases in diabetes mellitus. Next. And you can see endothelial dysfunction. Endothelial dysfunction is a systemic pathological state of the endothelium. It can be broadly defined as an imbalance between, see, vasodilating and vasoconstricting substances produced by or acting on the endothelium. See, very beautifully we can interpret. Vasodilating can be Vigasa and constricting can be Sangha. So, Adipravarti of a Srodas, excessive dilatation, Sangha of a Srodas, constriction, etc. We can even talk like that also, is related with a Srodas. So, what I am telling, the dilatation and constriction, Adipravarti or Sangha may not be due to an outside factor, it can be due to an inside factor by the endothelium, provided endothelium is damaged by the lifestyle. The smoking, the alcoholism, the junk food, the Vidahi Ahara, everything which we talk in the contemporary scenario are ultimately doing this endothelial damage, by which the Srodas will be in a confusion how much to dilate, how much to constrict. That is what is happening as Sangha and Adipravarti. Hope you are getting me. Next. And you can see these are the main factors which may affect the endothelium. You can see all the factors are responsible with the prameham also. Age, gender, family history, physical activity, insulin resistance, hyperglycemia, dyslipidemia, hypertension, obesity, visceral fat, smoking. All the factors mentioned in the modern pathology of endothelial dysfunction is applicable as a causative factor coming under either Raktavaha Dushti or Medovaha Dushti, putting together coming under the broad umbrella of Prameha Nidana. That is what I am telling. Next. And that is why they told very simply there is a condition called the metabolic syndrome. See, metabolic syndrome. Metabolic syndrome is a combination of medical disorders that increase the risk of developing cardiovascular disease and diabetes. We can tell even it as a Purvaruba stage of Prameha. There is no wonder you can see fasting hyperglycemia, high blood pressure, central obesity, overweight with the fat deposits mainly around the waist, decreased HDL and elevated triglyceride. Everything directly points to an Avarana stage, Medo Dushti. In a simple way, by seeing the picture, you can very well remember Charaka's definition of Stula. Let us salute Charaka, who beautifully told that Meda Mamsa Adivruddhatvad, Chalas Fig Udaras Tanaha, all the central obesity, Ayadho Ubajaya Ulsaha, Naru Adistula Muchade. So, my dear friends, the centuries old concept of Charaka's Taulia and the emerging discussed the concept of metabolic syndrome run together. That is why we have to think that Medo Dushti, Raktavaha Dushti are having important deciding role in developing the course and prognosis of diabetic complications. Next. And again, you can see metabolic syndrome versus Taulia, all the heart problem, obesity, hypertension, skin disease, cancer, everything which is mentioned in metabolic syndrome can be considered as Thulasya Upadrava. Next. So there is no need of any explanation. The picture is telling about our current lifestyle. and all these things can be leading to Raktavaha Dushti. So my point is there are two important words, Vidahi and Abhishyanti. Listen carefully. Vidahi Aharas will make vascular issue and Abhishyanti Aharas will create obstructive issues in the form of Medo Dushti. What is Abhishyandam? That is very important. Abhishyandam according to Sharangantara. Paichilyadu Gaurava Dravyam Rudhva Resavahasira. First time direct reference is there, which is proven by one angiogram. Rudhva Resavahasira. Obstruction in Resavahasira. Resavahanam Srodasam Hridayam Moolam. Coronary arteries are nourishing the Hridaya. So Resavahanam Srodasa Hridayam Moolam and Rudhva Resavahasira is nothing other than a block in the concerned blood vessels by atherosclerosis, and definitely that is happening in diabetes complications. So Paichilyad Gaurava Dravyam Rudhva Resavahasira Datte Yad Gauravam Tatsya Abhishyandi. This Gauravam is nothing other than Mala Sanchayam. It is not only the increased body weight, it is not only the issues with the BMI, it is the Mala Sanchayam. The word Gauravam is always indicative of Srodhorodham, because Srodhorodha Balabramsa Gaurava. So Amam, Mala Sanchayam, Srodhorodham, everything is told by a single word, Rudhva Resavahasira and Gauravam. You need Apatarpana Chikilsa. That is why Sandarpana Pramehi should do all the Apatarpana Chikilsa. I always tell to my students when I teach them the Kapha Dosho Vakrama, Nisugattam Sukhayecha. Are you following me? Nisugattam Sukhayeja. Only in Kapha Dosha Chikilsa it is mentioned by Vagbada in Dosho Vakramaniyam, Ashtangradayam Sutrastanam chapter 13. What he is telling, you don't do anything which is luxurious. You leave every luxury and you undergo all the hard working Nisugattam if you want to be Sukha in your later episodes of life. That is the current style what we are doing. We are not taking the good food what we believe to be taken. We are not sleeping. We are not doing anything. We are always hardly working, but that should not be causing any stress. So that is another aspect. So Nisugattam Sukhayeja. Next. And the importance when the endothelial cells are, let us come back to the endothelial dysfunction, because when we discuss the modern points more deeply, we can understand Ayurveda with the more evidence-based clarity. When the endothelial cells are healthy, they prevent the thrombotic events by expressing antiplatelet and anticoagulant molecules. Antiplatelet and anticoagulant molecules are very much similar with the Pramadhi concept in Ayurveda. Just opposite to the Abhishyandi, we have a Pramadhi. What is Pramadhi? A Pramadhi drug or Pramadhi diet will never allow intravascular clotting. So we can tell that an Abhishyandi may be triggering the possibilities of a thrombus, where Pramadhi will never allow a clotting. Nija virena yadravyam srodebhyo dosha sanjayam nirasyadi pramadisya tadyada maricham vacha. The drugs like maricha, vaja, which are having Kapha Vilayana property, will never allow Thamani Pradijayam or any intravascular Srodhorodha. That is why the word is important. Endothelial dysfunction makes the vessel susceptible to thrombotic events. So let us tell bye-bye to Abhishyandi Ahara. Let us tell bye-bye to Vidahi Ahara. Let us tell bye-bye to Medogar Ahara and practice Dhatogini Vibana Pramadhi types of Ahara Vihara. That is the single line statement for diabetic prevention in Kerala lifestyle. I am using the word Kerala lifestyle because we very well know we consume more quantities of the so-called Abhishyandi Ahara with Ega Sthana Asana Redhi. Sacha Bigamane Sthanam Sthana Dasana Michadi Asana Drinave Shayam Shainal Sobana Michadi. How beautifully Susruda told. At the time there was no World Health Organization. At that time, there was no World Diabetic Day. Still, Susruda told one who is walking, who prefers to be seated, one who is sitting, prefers to be lying, one who is lying, prefers to be getting sleep, sound sleep. That indicates that he is going to be diabetic. So let us always use this concept by which the activity level, the Vyayama level, the yoga level, the physical exertion level, etc. should be empowered, because Vibhakta Khana Gatrottam Vyayamadupajayate. Lakhavam Karma Samartyam Deepto Agni. Deepto Agni is nothing other than nothing other than empowering the hormonal functions within the body. Next. Now I will start with an experience. We will share some experience. You can see a case of diabetic ulcer. The patient was diagnosed with coronary artery disease, undergone angioplasty for the heart problem. You can see the entire soul is very much affected with a very prominent ulcer. Next. For 20 years diabetic duration with the coronary artery disease angioplasty. Next. Next. First, let us see the picture. Next. 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 We can see the size is getting reduced. We can see how the skin covering is developing over the big toe. We can see the color change. Next slide. See the bigger ulcer is becoming very small, and you can see the top of the big toe is covered with the delicate skin, and you can see the improved vascularity. Next. Again, the size is very much reduced. Next. Next. See, almost the big toe is covered with the fresh skin. Next. Now you can see the big toe is preserved there. Next. See, this is the comparison. Actually, this big toe was advised for surgical amputation. And we have tried with all possible Ayurvedic therapy. It took more than 7 to 8 months to get such a result. And 3 important medicines were given by me. First was Tiktaka Kashayam was given. And then Hinguvajadi tablet was given. And the third one, Guggulu Panchapala Churnam. These were the 3 medicines which we prescribed for this patient continuously for 7 to 8 months. And periodical, episodical Virejana was also done. Because Kleda Sanchayam will definitely hamper the normal wound healing. So I always think that the presence of Kleda locally, presence of Kleda in the system, both are dangerous. The local kleda can be removed by drugs, and even it can be removed by Rektamoshana Jaluga. But I was not in a position to think about Rektamoshana in this particular case, but that is another option. And systemic kleda can be removed by Virejana periodically. And the drug Singuvajadi was given only for its Vadanilomana. I believe Vadanilomana is not applicable to only Kosta, it is applicable to Shakha. And the Guggulu Panchapala Churnam, I believe the best antibiotic in Ayurveda. It is mentioned in Bhagandara, Guggulu Panchapalam Paligamsa, Magadiga, Jatrpalaja Pradaksya, Tuktudi Kasha Yudam Madulidam, Pushta Bhagandara Gunma Gedikhinam, Gedi, Nadi Varna was the indication, so I selected. And Tiktakam Kashayam was purposefully selected to make the Prana Shodana Robana, Medo Robana, Rekta Shamana, Pitta Prasadana. So Tikta Rasa internally and Virejana as a Panchakarma combined together. So this is the dosha based treatment protocol. I am not telling that for every diabetic ulcer you follow this. According to my concept, at the time of the treatment, the patient had a stage of more pitta with Kapanibanda and Medo Dushti. So I opted the treatment like that. So my humble point is, you can see the result. The patient was advised for the big toe amputation, but we could save it. So proper Ayurvedic assessment in terms of Vikalpa Samprapti is the important point. Let us know every modern. We very well know all the reports. I have done even coronary angioplasties to that patient. I know everything, but it doesn't mean that our fundamental concept should be diluted. So every modern knowledge in your left brain with all possible Ayurvedic treatment with the clinical inputs in the right brain, you make a very good symphony, harmony. Definitely you are going to do the Dhadu Samya. Pravartar Dhadu Samyartha Chikilsa Iti Abhidiyade. Salute to you again, Charaka. Next slide. Then peripheral neuropathy. Now we will go to peripheral neuropathy, because peripheral neuropathy and diabetic foot ulcers often coexist. Patient may be having improper skin sensitivity. They may not be able to identify even small injury. So earliest and the commonest diabetic neuropathy is peripheral neuropathy. Gradual and progressive. Both the words are important. Gradual but progressive. Sensory motor neuropathy. Both are affected, and lower limbs get affected first. See how beautifully Susruda told Pramehinam Athakaye Prayena Pidaga Pradur Bhavadi. They also told that due to the gravity impact, the peripheral ischemia will be dominant in the lower limb. Athakaye. Next. And clinical presentation of the peripheral neuropathy, diabetic peripheral neuropathy, DPN, paresthesia, where the patient will be telling about the numbness, burning sensations, there will be daha, etc. Loss of tendon reflexes, that is the advanced stage where the tendon reflexes will be lost, indicating motor neuropathy. Decreased vibration and touch sense, very, very important. Nowadays, we are getting so many patients who are telling that they don't know what is happening to their sensation. They will tell that the foot wears are not kept properly, and definitely there will be improper vibration sense and touch sense, muscle weakness and atrophy, and Charcot's arthropathy. So there can be so many issues. So I am telling you to read Vadika Upadravaso Prameha. We are discussing the complication. Okay. Vadika Upadravaso Prameha, Vadigana Mudavarta Kanda Hridgraha Lolada Shula Munnidrada Shosha Dvarakasascha Jayade. Two words are there which I wanted to stress here: Shulam and Shosham. The diabetic peripheral neuropathy with the typical pricking pain, Shulam, and Shosham, Mamsa Shosham, and which can be even leading to the food drop. So Mamsa Shosha, Snayu Shosha. Why? Snayu, maybe the nerve, if damaged, Mamsa will be affected. Because Mamsa Vahanam Srodasam Snayu Moolam. See, these things are beyond the modern perception. Mamsa Vahanam Srodasam Snayu Moolam. So if there is a neuropathy, Snayu Gata Vada, definitely the concerned muscle may undergo wasting Shosha. That is why Ayurveda told Shulam and Shosham under single Vada dominant complication. So there are so many things which we can explain even without using the modern concepts. Next. The neuropathy relation with the Supti Vada. Supti is very much similar with the Nambina. Supti Vada is the condition where there is Kapani Bandham. Vaino Dirda Sleshma Tojam Prapisa Visushadi Tadastok Jayade Pandu Kramena Chavichedana. See, gradually Vijedana Sa Prasupti. So Supti is important, and you can see Supti is mentioned in so many conditions where there is a Kapani Bandham. Ubadhadus. What do you mean by Ubadhadu? It is not the Rasas Tanyam Rectal Asr. No, it is the Snayo Sira Kandarepya, the peripheral tendons, peripheral muscles, peripheral nerves, peripheral vessels. Snayo Sira Kandarepya Dushta Krishnandi Manavam Stamba Sangoja Kallipur Grandi Spurana Suptayaha. Charaka beautifully told the various peripheral structures like tendons, ligaments, nerves, arteries, which are affected, and there will be all the features mentioned in diabetic neuropathy. Kledadikya may be the triggering factor. So many patients will tell me that when there is a momentary increase of the sugar level, hyperglycemia, above the 200 level ppbs, definitely they will be feeling more muscle cramps in the nights. So Kledadikam is directly proportional with the neuropathic damage, and Ektavaha Srodhas get involved in some cases, which may be leading to diabetic ulcer. Okay, next. Then role of Ojas, very important. We don't give much importance to Ojas in Prameha Samprapti. We should not allow the patient to lose his Ojas, because in my personal experience, as long as we are maintaining the Kapha in a very good Prasada stage, the complications will be minimum. When Kapha decline and Pitta is also decline and reaching to the Vada, all the complications will start immediately coming to the patient. And Kapha declining is nothing other than Dhadushayam and Ojachayam. And Mamsashaya, muscle weakness and atrophy are very commonly seen. We can see a condition called diabetic amyotrophy. Another complication, the thigh muscles and the gluteus muscles will be undergoing Shosha, wasting. So they will be telling that the mass of the thigh muscles are less getting down, and all these things are indicating atrophy. And Sandhi Vislesham, I think it is very much comparable with the foot drop. In Ojo Dushti, you can see Sandhi Vislesho Gatranam Sadanam Doshachavanam Kriya Sandirodacha Visram. Say that Sandhi Vislesha is applicable to even foot drop, and Sandhi Shaidilyam is there, Sladhangatvam is there. The compactness will be lost due to myonecrosis. All these points are very well explained by Ojochaya. So Ojas is to be protected by Ahara, Vihara, and by proper Vigara, because mental components will also cause Ojachaya. Ojakachiyade, Kobashuddhyana, Shoga Sramadibhi. So a diabetic patient should get a very good Adrevya Chikilsas to keep his mind in a pleasant state to prevent the stress-induced Ojo Dushti. That is also, see, all the areas mentioned in Ayurveda can be effectively, judiciously, systematically, scientifically utilized for diabetic complications. Next. Neuropathy in Ayurveda, Upadrava Roga with the Vada domination, Kapha Pittas also contribute. Let us recollect two terms, Pada Harsham and Pada Daham. Pada Harsham, Krishyade Charano Yasya Pavedam Prasuptavat, Pada Harshacha Vigneya, Kapha Maruda Kobaja. Here I have seen an important finding. Charanau, they told both Charana, both legs. In modern also bilateral distal polyneuropathy. So Kapha Marudam. And on the other hand, the pitta domination with the Rakta Dushti will be leading to Pada Daham. So Kapha dominant Pada Harsham numbness, Pitta dominant Pada Daham burning, Padayor, Kurude Daham, Pitta Astra Sahido Anila, Visheshadas Changramide, especially while during walking, Pada Daham. So my dear, what I am telling is Pada Daham, Pada Harsham, etc. mentioned in our Vadavyadi is also having some relation with the diabetic peripheral neuropathy. Daptokinimandya is the root cause. I told you, due to the hyperglycemia, Dhadu Mala Sanjayam. I think hyperglycemia, Kleda will definitely damage peripheral nerves. Avarana plays a vital role in some stages, eventually Dhadushaya. So Kleda Vriddhi will be doing peripheral nerve destruction, and when the nerve destruction is there, Mamsashayam, Rektavaha, Srodoroda related things will be aggravating to Brana, etc. So there can be even gangrene. So everything will be due to the Kleda Sanchayam. That is why Tripala, Gugulu, Halladaga, etc. are very important drug in preventing occlusive episodes of diabetes. What is occlusive? Avarana Srodoroda Jenya. Avarano Margasya Rodaha. Marga can be a chemical reaction. Marga can be a vessel. Marga can be the combination of two dosha. When Kapha is obstructing Vada, you are getting less circulation. When Kapha is inhibiting Vada, there is less motor and sensory activity through a nerve. I am telling you, when there is a reduced sensation, that is due to Kapha inhibiting the Vada, because Nenda, Praneda, Jamana, Sarvendriyana, Mudyogagara, everything is Vada. Vada is inhibited by Kapha. Sthira Guna, Snigdha Guna, Guru Guna, Manda Guna, Kapha inhibit, Legu Guna, Rocha Guna, Chala Guna, Vada. That can be measured by nerve conduction study. So everywhere the Kledadikya is the basic pathology which will spread to Shaga, Posta and Madhyama Roga Marga, and you are getting neuropathy like complications. Why I am telling the detailed pathology, then you can select the proper drug diet according to your clinical wisdom and your patient, and that is the most scientific way. For every patient, telling a drug is not at all practical and not at all scientific. Identify what is happening. Try to explore what is behind the samprapti of your individual case, then go for the diabetic protocol management. That is why I am trying to trigger your scientific thoughts in Ayurveda. Next. Then Ayurvedic management principles in diabetic neuropathy, definitely no doubt there should be Pramehahara. Kleda Shoshanam is mandatory. Srodorodaharam must. Dhatuginadibanam must. Vadanilomanam Rasayanam. Any drug, diet or drink or any therapy which can bring all the components together, that will be the best diabetic neuropathic protocol. Next. Some of the combinations which we try, Bhunimbadi Kashayam. Bhunimbadi Kashayam is mentioned in Kushta Chikilsa. Kushta Meha Prasuptina Paramam Syad Aushadam. See, Kushta Meha Prasupti. We very well know there is peripheral nerve damage in leprosy. And we very well know Kushta is also having neuropathy. And we very well know Supti is associated with nerves. And that is why the reason he told Kushta Meka Prasuptina Param Syad Varaushadam. And in Kushta also Kleda is there. In Prameha also Kleda is there. And Bhunimbadi contains Tiktarasa drugs. I told you already, Kleda Shoshanam, Rekta Prasadanam, Agnidibanam is Bhunimbadi Tiktarasam. Buduji, already we discussed Asanadi Ganam. Very important. Especially when your patient is obese with dyslipidemia, fatty liver, etc. This is best by Asanadar Vijayade Chitra Kushta Kapakrimin Pandirogam Prameham Cha Medo Dosha Nibarkana. When there is Pandiroga, Prameha and Medo Dosha together, because the presence of Pandiroga itself will delay the wound healing. The presence of Pandiroga will be definitely adding to the hypoperfusion, and there will be again delayed wound healing. So a yoga which will work in Pandu by empowering the Rektasara, and a drug which will be definitely bringing down the Medo Dushti, and a drug which is directly Prameha Shamana, that is Asanadiganam. My favorite in obese patients, my favorite in Medo Dushti, my favorite in Medo Dushti and Prameha. Asanadar Vijayade Chitra Kushta Kapakrimin Pandirogam Prameham Cha Medo Doshta Nibarkana. Then Ashtavargam Bella Sakata Reiranda Shundi Rasna Suradrumai Sa Sindhuvara Lesunei Ashtavargo Anilabaka. But the problem, never prescribe Ashtavarga in Pitta dominant condition because the drugs are Tikshna. And Ashtavargam contains Lesuna. Lesuna should be avoided in Pitta Rektanubandha. Otherwise, it is very good to prescribe Ashtavargam. See, that is what I am telling. Unimbadi, Pittanibandham, Ashtavargam, Kapanibandham. The dosha status is very much important. Varanadir, Kapam Medu, Mandaginidam Niyachadi, Adivadam, Shirasulam, Gulmam, Chandasa Vidradi, Vidradi, abscess, internal inflammation, Vrka Vidradi, nephritis, multiple internal Vidradi, Pittavasta, and there will be Kava, Mandagini. Then definitely you can think about Varanadi. Mandagini can be applied to the Dadugada Agni Mandhyam, applicable to less functioning of the insulin. And Gugulu preparations, no doubt, Medu, Anile, Gugulu, and Gugulu has very good impact in almost all the diabetic complications. So these are the different prescriptions. Next. And decoction of these are some practical drugs which we daily prescribe in neuropathy. Aranya Jiraga, Eganayaga, and Nimba. Only 3 drugs you can make a decoction. Aranya Jiraga, Eganayaga, Nimba. Decoction of Darvi, Devadaru, Faridagi, Amalagi, Ifidagi, and Musta. Some practical drugs which will remove the kleda, which will create more Srodoshuddhi in the peripheral limbs, by which promoting the Srodos Saushtavam and bringing back the normal vascularity. That is the Darvi, Devadaru, Haridagi, Amalagi, Vipidagi, Musta combination. So you can think according to your logic, but the logic should be satisfying the underlying dosha status. That is the only thing. Okay, next. Then external treatments in neuropathy, no doubt, Uddartanam, Kabagaram, Medasaka Pramilainam, Tripala Churnam, Yapa Churnam, Vara Churnam, Kolavulata Churnam, anything can be done, provided there is Kapanibandam, Dhanyamala Dhara. It is a very good treatment, especially in Rekta Vardavada with the burning condition. Takradara to the Murda or even to the periphery can be done where there is Kapanibandam. And even Chidadara can be done with the Karaskaratok. Chidadara can be done with the Chiri Vurshatok if there is excessive burning. So you can think about the Chidadara, Takradara, and even Dhara with Dhanyamala, or different types of dravyas can be selected depending upon the Harsha, depending upon the Daha. I am telling Shula, Vada domination, Tailadara, Harsha, Kapha domination, Takradara, Daha, Pitta domination, Shidadara or Dhanyamala Dara. That is logical. Next. Diabetic nephropathy. So many things are there. I am giving some basic idea about the complications since our time is limited. Diabetic nephropathy. Next. You can see treatment of diabetic nephropathy is very much similar with the Kapaja Prameha Chikitsa. Not all the types of diabetic nephropathy I am telling, but most of the diabetic nephropathy in the initial stage is similar with the Kapa Prameha, and my experience is with the Kapaja Sopa Chikitsa. Kapaja Sopa Chikitsa, Kapaja Prameha Chikitsa are very much applicable in the first episodes of diabetic nephropathy. Rucha, Kledahara, Rasayana drugs are the need of the hour. Rucha, Kledahara, Rasayana drugs are the importance. Koda, Shidi Bushatto Kashayam. If there is more Vadavitanibandam, Shidi Bushatto Kashaya, Asanadi Kashaya, and Valsagadi Gana Kashaya. You can see all the Kappa Shamana because Medo Vahanam Srodosam, Burko Moolam, and Kappa can definitely inhibit the glomerular filtration. And Kapaja Sofa Lashanas are evident in the patient. So these are the important medicines. Next. Treatment for diabetic nephropathy, Aragodadi Kashaya. That is what I am telling. Even though it is not directly mentioned in Prameha, the Dosha Prataniga and Kleda Nirharatam of Aragodadi is very much important in Kapaja Prameha related complications of nephropathy. Punarnamadi Kashayam is no doubt that is also prescribed as per the Vyadhyavastha. Next. Then some churnas like in Negrodadi churna, Nishamalagi churna, Tripala churna can be given 5 to 10 grams with hot water. And when there is advanced stages of diabetic nephropathy with the Vada complication, you can think about the Dhanvantaram Kridam, you can think about the Vasthyamaya Kridam. But never do these preparations when there is more Kleda. You feel that the Kapha stage is over, Pitta stage is over, and it is more Vada related stage, then you can definitely think about the Grida Kalpana. And Dhanvantaram Kridam is especially mentioned for Prameha Upadrava in Prameha Chikitsa, a very good combination. I had given this Dhanvantaram Kridam mixed with the Tripala Churnam to so many patients. It is very easy. How to give this? You have to take 200 gram of Dhanvantaram Kridam and add 100 gram of Tripala Churnam and mix it. It will be kept as a Avaliha Kalpana, and every bedtime they can take 1 tablespoon. So that is very simple. Dhanvantaram Kridam, 200 gram you take and mix with 100 gram of Tripala Churnam, make it as a very good combination with a homogeneous mixing, and every night the patient can take it, provided there should be proper assessment of the dosha status, because triphala is kleda shoshanam, that can be ruksha, but when you give in gruda, that will not be there. So you are balancing the possible shifting of dosha status to a very fast vada from Kavavita. That is the art and science behind this combination of Dhanvantaram Gridam and Triphala Churnam. Very simple. Most of the patients are keeping it in their own custody, even when they travel also, bedtime they are consuming. Vastyame and the Gridam, no doubt that can also be tried in the advanced Vadiga stages of the diabetic nephropathy. Next. Diabetic retinopathy, that also I will tell something. The leading cause of the blindness related to the degree and duration of diabetes mellitus. That is very important. How much gravity to the sugar value, how much the duration. These kala samprapti, bela samprapti, both are important in diabetic retinopathy. Next. And you can see the normal retina and retinopathy. In retinopathy, we are getting two types: the proliferative diabetic retinopathy, PDR, and NPDR, non-proliferative diabetic retinopathy. In NPDR, the changes are within the retina, and you can see the retinal hemorrhage is occurring, and retinal aneurysm. You can see the aneurysms are the dilatation of the small blood vessels of the retina. They may break, they may rupture, leading to the hemorrhage, and there can be retinal blood vessel occlusion. So there can be retinal hypoxia. Hypoxia means due to the blockage in the retinal blood vessels, the retina will be getting minimum oxygen. So to compensate the oxygen lack, new blood vessels will grow. We call it as neovascularization. It's a compensatory mechanism, and the growth of new blood vessels to compensate the retinal hypoxia in presence of vascular endothelial growth factor can also be called as adipravarti of the srodhas. Adipravarti need not be diarrhea. Adipravarti need not be polyuria. Adipravarti can be the excessive formation of the srodhas. Here the blood vessels are growing beyond the need due to the hypoxia. So that can also be considered as adipravarti. Next. Netra vigaras in prameha, kava pragoba in the site of tejas. In the opening slide, I told you, chakshus tejo mayam tasya visheshal sleshmana bhayam. A very beautiful title song of Shalakya Dandra in diabetes. I am telling it as a title song. Chakshus tejo mayam tasya visheshal sleshmana bhayam. Eye is vascular, so it will be having threat from the kapha. Kapha is the opposite of Agni. Srodho Roda in Raktavaha Srodhas, Abhishyandana of Netra. We can call it as Abhishyanda. Excessive kapha creating a damage with Srodho Roda in the eye is similar to Abhishyanda. And then definitely there will be Mala Sanchayam, and that is macular edema. What we are telling can be called like that. And Sannipadiga type of pathology. In my opinion, my humble opinion, in the opinion of a Kayajigil person, I am telling you, diabetic retinopathy will be passing through different dosha stages. In the occlusive phase of Mala Sanjayam Kapajam, in the bleeding hemorrhagic, dot-shaped, blame-shaped, and flame-shaped hemorrhages Pittam, and diabetic retinal detachment Vadigam. So different dosha status can be observed if you follow the diabetes retinopathy in a systematic Ayurvedic way. Next. Then in Ayurveda, diabetic retinopathy, a paradandra vyadhi, means it is dependent, manifests in the later stages of Kriyagala Prameha, that is Kriyagala. You can very beautifully teach students Kriyagala by telling diabetes and complications, especially retinopathy. Specific dosha pattern in different stages. Sushma Srodhasas of Drishti Mandala, that is microangiopathy, are affected. So it can be considered as an Indriya Pradoshaja Vyadhi. Next. Very interesting slide for you to provoke and trigger your thought process, thinking pattern. Sangha is there in eye in DR because of occlusion of the retinal vessel. Sira Grandhi can be there in retinopathy as there is aneurysm. Aneurysm means growth of dilatation of the blood vessel. Adipravarti can be there in the form of new blood vessel formation. Vimargamana can be due to retinal hemorrhage and macular edema. So my dear friends, even for the complication of diabetes mellitus as diabetic retinopathy, you can easily, proudly tell all the four Srodho Dushti mentioned in Ayurveda. Adipravarti Sangova, Sijanang Grandhayo Viva, Vimargado Vagamanam Srodasam Dushti Lakshanam. See how much integrated is our functional anatomy as well as clinical fundamentals. You can apply all the 4 types of Srodo Dushti in different stages of a modern based disease called diabetic retinopathy. This is the way to utilize the Ayurvedic fundamental by exploring the clinical pathology by modern medicine. Sangha, Siragrandhi, Adipravarti, Vimargamana can be stage wise, crystal clear clarity you can mark in your patient if you follow the clinical fundamentals of Ayurveda. Next. And you can see in the picture, all the 4 are there. You can see the retinal edema, the retinal hemorrhage, macular edema, and you can see the last picture. The vascularity is compromised. The Tejomaya Agni Rupa retina is becoming somewhat black, indicating Vada. We very well know Vruddhastu Kurudi Anila Karsham Karshniam. Wherever there is Vada, Karsham will be there, Karshniam will be there. We can compare the very dominant Tejo Bhuda retina is converted into Karshnia, indicating Vadiga related progressive damage. So Prameha will become Vadiga Prameha, and Netra Roga will also go to the Vadiga, losing the Pitta status. And when the Pitta status is lost, Tejo status is lost, I will not be vascular, and if vascularity is compromised, Indriya Pradoshaja Vyadi may occur and can lead to Indriya Nasha, Vadigam, and it can be the blindness. Next. Role of Tridosha, basically Sannibada pathology, different dosha dominance in different clinical stage, leakage, exudate, edema in the retina, kapha, hemorrhage, I told you flame shaped hemorrhage, dot on blood hemorrhage, pitta, and terminal stage with the retinal detachment, vada. Why? There should be some element of kapha / shalingane that is undergoing shaya. Vascularity compromised, there is no more nourishment, so naturally detachment will be there, indicating Vada dominant Ruksha stage of diabetes retinopathy. Next. And what can be the Ayurvedic protocol? Pramehaharam, Rekta Prasadanam, Srodo Rodhaharam, Shobhaharam, Vatanulomanam, but in different stage. Rekta Prasadanam in the second stage, Shobhaharam in the first stage, Vatanulomanam in the first and second stage, and Brahmana Chikilsa without increasing the Medo Dushti in the Vadiga stage. Tarpana can be done. So initially do Aschodana, Anchana, which will be removing the kapha. We studied Netra Roga in Sutrasthana, 2nd chapter, Dinacharya. Don't misunderstand me. I am not teaching you Sastavartam. I am not teaching you Shalakyam. I am not teaching you Kaya Jigilsa. I am teaching you Ayurvedam. Beyond all the so-called compartments. Chakshus Tejomayam Tasya Visheshar Sleshmana Bhayam Yojayel Saptaratre Asmal Sravanarthe Rasanjanam. Then cause is mentioned, treatment is mentioned in the 2nd chapter, even without starting in Shalakyam. So Sravanarthe Rasanjanam. So there should not be any kapha, rupa, mala, sanjayam in the eye. That is why Anjanam, Aschodanam and other treatments are there in kapha stage. And Pitta Shamana, Shidavidya drugs like Drachadi, Vasha Guduchadi, Rekta Pitta Chikilsa in the hemorrhagic phase. And when there is Vada dominant condition, you can think about the Tarpana. Netra Brahmanam is Tarpanam, Jivandhyadi Gridam, Sadahwadi Gridam like Tarpana, etc. So I am telling you different protocol of diabetic retinopathy as per the dosha evaluation is the most important thing. Next. Clinical stage determines the treatment. Srodo Rodhakara Chikilsa in occlusion. Kaphadiga Abhishyanta Chikilsa can be applied in occlusive phase. Ruksha Tishna Karmas can be done in the occlusion is more. Kleda Shoshana, Tripala, etc. are more in such condition. Ugulidikta Kashayam, Tikta Kashayam, and Guduchiadi Kashayam, etc. are very much important in such a condition. Darvyadi Kashayam, very much important. Next. Then Urdaga Rektapitta Chikilsa can be applied in hemorrhagic phase. Vasha Guduchiadi is a very important drug. Vasha with the pippali and honey is there. Shiro Leba with the Grida Prishta Amalagi. You fry the Amalagi in the Grida and apply as a Lebana in the Shiras. That is indicated in Chakradatta, telling that Seduriva Toyavegam Runathi. Just like a when you are constructing a dam, how it is preventing the water, the Toyavegam Runati, the bleeding can be arrested. So Urdaga Rektapitta Chikilsa can also be applied in Akshigata Rektapitta related hemorrhagic phase of diabetic retinopathy. Next. Then in macular edema, no doubt there is Shobhagara Chikitsa. All the treatments mentioned in Shobha Chikitsa, you can give a Dashamula Haridagi in a non-jaggery form. Without Madura, Dashamula Haridagi, Dendi Haridagi, etc. can be given. Haridagi preparations are very important, and Kavavitakara Chikitsa can be given, and Murdini Leba. You can select the lebas which are Shobhagara, Abhishyandakara according to the dosha status, and then definitely there will be a reduction in this Shobha. Kapaja, Shobha Chikitsa, Kapaja, Abhishyanda Chikitsa are applicable in macular edema, Pitta Abhishyanda Chikitsa in hemorrhagic phase, and Vadiga Abhishyanda Chikitsa and mild Brahmana without causing kleda by proper Tarpanadi Krama can be done in Vadiga phase. That is the logical order of diabetic retinopathy management as per using fundamental Ayurvedic clinical protocol. Next. Where to look in the science? So I am concluding, when you are getting all the complications of diabetic retinopathy in cooperation of Kapha Pitta Timira Chikitsa. See, unfortunately, there is no chapter called diabetic retinopathy Vyakyasyamaha in Ayurveda. So you go to the Kapaja Pittaja Timira Chikitsa, Abhishyanda Chikitsa, and Paitiga Prameha Chikitsa. Some of the Paitiga Prameha Kashayas mentioned by Sustrada are very much useful in different episodes of Paitiga stages in diabetic retinopathy. So some yogas mentioned in Prameha itself is inclusive of retinopathy. Because in Purva Rupa it is clearly mentioned Sedanga Ganda Shidilatvamange Shayasana Swapna Sukhabhishanga. Next word, Netra Jihwa Sravanobadeka. See, without an ophthalmoscope, without a fundoscopy, Ayurvedic Acharyas told that Netra Upalebada can be there. Netra Jihwa Sravanobadeka. See, without an angiogram nowadays we cannot predict that there is a block. But in the Purvaruva Prameha, Ayurveda told that Hridaya and Netra can be affected with Upalepada. So that is what I am telling. Eye is considered even in the Purvaruva stage of Prameha. So that word is very much important. Next. So the last word, to prevent or to control the diabetic complications, episodical purification is must. You cannot ignore the role of Shodhana Chikitsa. Yedu Samshodhane Shuddha Natesham Punarudbhava Buddhi Prasadam Velamindriyanam Dhadu Stiratvam. Dhadu Stiratvam in multiple sites is very much important in a Dhadu Shaidilya Roga Prameha. And how you can get to Dhadu Stirata? A properly done Shodhana in the proper time. Episodical Virejana. Ksharavasti, if there is more Kapanubandam, more Avaranam, more Margaserodam. Yavanavasti to give a healthy life with the blessed life, and I show Yavanam Dirthagalanuvartanam Yavanavasti, Madhu Tailika Vasti, no doubt. The Vasti which is supposed to be Rasayana Shamanam, which is supposed to be Rasayanam, Vajigaranam, and Prameha Shamanam. A common Vasti which is indicated for Prameha with the Rasayana and Vajigarana properties, Madhu Tailigam, that can be given, and you very well know the role of Madhu in eye. Chakshusham, that is very important, and Rekta Moshanam, especially when you are getting a Pitta dominant ulcer, Jalogavadaranam is the most thing, because that is very much effective in Paitiga Brana, Paitiga diabetic ischemia conditions like that. Next, and no doubt there should be Rasayanas like Shilajadu, Triphala, Guduji, Jivaniya Grida. Shilajadu will definitely remove the Avarana, and Triphala will be secretagogue. So insulin resistance, that is peripheral Chedana karma is done by Shilajadu. Chedanam is a universal karma of Shilajadu, and Triphala is more secretagogue and Kleda Shoshanam. Both are important. Guduji, no doubt in vascular structure, Vada Rekta, Rekta Vardavada, autoimmune disease, Guduji is mandatory, and Jivaniya Grida, especially Pitta Shamanam, Ojo Vardagam without Kleda Vriddhi. So these are the commonest Rasayana. You can select any Rasayana depending upon the condition of the patient based on dosha dosha profile at the time of your treatment. Next. And finally, one word I should repeat, Pathya and Apathya, because we cannot control the diabetes without dieting, without drug, without Aushadha. Ahara, Vyayama, Vihara, Aushadha, everything is there. Use of Pramadi Drivya. What is Pramadi? Anything you can eat which will not create a Srodha. Which is creating Srodha is Abhishandi, opposite is Pramadi, and in the new methodology you can tell Abhishandi diets are having high glycemic index. Pramadi drugs are having low glycemic index and all the fiber-rich foods which will make your koshta in a madhyama stage. We always tell that koshta should not be krura and Agni should not be Vishama, Manda, Tishna. But here, the fiber-rich diet, the medicated diet, Takrakalpana, all the so-called Abhishandi, opposite Pramadi diet, drug, drink. I always tell the 3D, diet, drug, drink, which are typically Pramadi should be practiced because they will not be having much kleda, more pathology, multiple dadu, multiple complications. So that is to be kept in the mind. So next slide, we are coming to the conclusion. Summary, Maharoga with Madhyama Roga Marga involvement. Madhyama Roga Marga itself is the dangerous word. All the Shiro, Hridaya, Vasti, Snayu, everything is coming there only. All the so-called vital organs are coming there only. Multifactorial etiopathological involvement. Different pathological component. Bija Dushti from one side, lifestyle factors from another side, stress from another side, chronicity, another importance. So all the multifactorial cumulative effect will be there. Samudaya Prabhavam and multidimensional approach is the answer. If everywhere there is Yam, Maharogam, multifactorial etiopathology, you also need a multi-dimensional approach. Aharam, Viharam, Aushadam, Vyayamam, Nidra, protection of the voices, everything are there. So in short, apply everything in the proper way in your lifestyle. That is the only answer to solve the problem to a very good extent. Next. So my last slide, a change in the lifestyle makes the color change. When we measure the urine, you very well know the different color stages are there. The brick red color is indicating the maximum 2+. And when the lifestyles are applied, it will come back to the normal pale yellow color. So you can see two pictures are there. The red color, Vada, Pitta, Kaphas are the culprits. And in the normal yellow color, you can achieve by Ahara, Aushada, and Vihara. A for Ahara, O for Aushada, and V for Vihara. So the brick red color to the normal pale color of the urine with the minimum kledam, with the minimum avila mutrada. Please follow Aharam, Aushadam, and Vyayamam. All the three are having equal importance. Actually, even one wheel is lost. This three-wheeled chariot can no more travel. So all the three components are equally important in Prameha. Next. So that is my humble presentation. Whatever limited knowledge I am having, I am very much thankful to Dr. Anil Kumar and Kerala Ayurveda for giving me an opportunity to share. So only last message, read multiple chapters, Prameha Jagilsa, Vadavyadhi Jagilsa, Pandu Jagilsa, Kushta Jagilsa, Visarpa Jagilsa, Brana Jagilsa, Dinajarya, Urdujarya, Panchakarma, Rasayana, Adrivya Jagilsa, and don't limit your reading only in Prameha because you are fighting with a very powerful enemy of the century. So take every weapon from every Brihatrayi, every Lagutrayi, and ultimately from your own clinical consciousness. Learn Ayurveda, love Ayurveda, live Ayurveda. Thank you. Thank you very much.
Thank you, Dr. Govumar, for that enlightening speech on the subject, complications of diabetes. So it's a comprehensive presentation. You have covered all aspects of diabetes. I need not explain that because everybody knows that. And your detailed explanation on Ayurvedic pathology has given a lot of worthy points to all of us, especially the practitioners, I think. And the correlation with the modern aspects like endothelial dysfunction, metabolic syndrome, all this is very, very informative for all of us. And the elaboration on cardiac problem was also very, emphasizing, and especially the specific drug combination which you have mentioned, a new insight to all of us, because many of the products, how it has to be combined with the dosha relation is a very good information. So I thank you very much for this informative presentation. And now we have a few questions to be taken up. Let me go through the questions.
Please.
Yeah. The first question is now, any role of Agnikarma on Prameha?
See, actually, Agnikarma can be done in certain peripheral ubadadu pradoshaja vyadi, if there is a problem to the tendons, because snava sandhi sira prapte sveda daha upadahana. In snayugada pathology, dahakarma is indicated. So you can try in certain conditions of kapha dominant neuropathy conditions. Only in a hypothetical way I'm telling, I have not tried, but technically since snayus are affected, definitely there is a role of dahakarma. So if you are feeling that there is a kapha dominant mandaguna, etc., just like we are doing agnikarma in carpal tunnel syndrome, where the entrapment in neuropathy is there, we can try, provided there is no pitta nibandha and there is strong evidence for kapha, because snayugata vada, the treatment is daha.
Okay, thank you. And reference of medicines used in the case of foot ulcer.
See, I told 3 medicines. First medicine is Gugulu Panchabala Churnam. You refer Ashtangradayam Uttarasthanam Bhagandara Chikilsa. Second is Tiktaka Kashayam. You refer Ashtangradayam Kushtaroga Chikilsa. Third is Ingubajadi Churnam. You refer Ashtangradayam Gulma Chikilsa.
Okay. Then in Nimba decoction, no, the more effective part is bark or patra.
Bark, sir, bark. In a Vrana Robana condition, Leba, Nimba Dalil Kalka Vrana Shodana Robana by Sargadara. If you are attempting only Vrana Robana, the Nimba Kalka is with the leaves. But if you are going for Kashai, etc., Nimba bark is better.
Treatment of Prameha in Krisha Dehi.
That is clearly mentioned. Amedo Mutrale Krisham. Brahmahe Daushadahari Amedo Mutrale Krisham. Read Ashtangradayam Prameka Chikilsa. Never use any drug which is increasing medas and mutra. Means avoiding kleda, kara, ahara, vihara, do brahmana. Brahmana in the sense of controlled brahmana. You can think about silajadu preparations, you can think about the Dandandana Grada, but never apply any Grada which is increasing the kleda. Amedala, Amutrala, brahmana.
Then difference in the use of Shilajit and Balladaga.
See, Balladaga is Medhe Rasayana, Shilajadu is Chedana, but both are Kapashamana. Balladagani, Tishnani, Pagi, Nagni Samanija, Bhavati Amrada Kalpani, Prayuktani, Yathavidi. And more pharmacologically in Prameha, Kapajostina, Rogostina, Vibandosthi, Yastana, Yamna, Balladagam, Hanyat, Shikram Agni Balapradam. So the point is, Balladagam is very good in removing the block, Vibandham. But that is a very powerful rasayana. But when you come to Shilajadu, Shilajadu is Chedanam. Dibandhaharam and Chedanam are different. Chedanam is from the Medo Dushti. So when there is more Medo Dushti, the Shilajadu will create the Chedana and it will create better blood circulation. But Bhalladagam is directly working on the Vibandha. But ultimately both are having Kapashamanam only. But Shilajadu is widely prescribed in Rektavahas Rodo Dushti, whereas Bhalladagam is widely prescribed in Mamsavahas Rodo Dushti. That is why in Shushkeshu Bhalladagam Agriya Muktam. When you read Shushka Arshas, Bhalladagam is Agriyam. And Arshas is definitely coming under Mamsavahas Rodo Dushti.
Okay. Then there is a question on what is Ojo Meha? Can Ojo be seen presence?
See, actually, that is a conceptual part only. Ojas is mentioned as a Dushya in Prameha. So, what Ayurvedic people believe it that through the Mutra Dushti, excessive Mutra is lost, Ojas is also lost. Just like we are telling that Astimeha, etc. So, Ojas is lost not through the urine, but the entire patient will become the Dhadusara Hinada due to polyuria. And actually, polyuria is a symptomatology of Ojonasha and Prameha. It is not meaning that Ojas is lost through the urine, but chronic advanced Vata dominant stage, Ojashaya can be seen. That I had already told. So, Ojashaya in advanced Prameha can be correlated with Ojo Meha, and it doesn't mean that Ojas is lost through the urine.
Okay. And there is a modern medicine related question. It's like, no, can you please talk about statin? With statin, will it help? Cholesterol medicine, will it help diabetes?
See, that I should not answer because these are the medically challengeable issue, but most of the people are taking it. So I am not the authority to comment on that, but we can see that in the practical field it is there, and it is also prescribed by a medical science. So I should not comment on that. But one thing is common: when there is a Sandarpana Pramehi, there should not be well checked, controlled lipidemic level. That is mandatory. Either by modern, either by even Ayurveda, you can even control by diet depending upon the dyslipidemia range. But the issue is metabolic syndrome and all resultant complications are due to the Medodushti, so that should be checked. That is the point.
Okay, then one more question is now, you mentioned about Kledavritti in Shukradadu in males. So in the ladies, can we consider having Prameha with PCOD as Kledavritti?
See, in PCOD, the basic underlying pathology as per the modern medicine is insulin resistance. You are getting a very similar pathology of insulin resistance in PCOD, Medodushti. Of course, there are Krisha types of PCOD are also there, and Avarana is occurring in PCOD to a good extent. So, Prameha related Avarana is playing. It cannot be the Kleda as such. It is the Avarana by Kapha-Medo principles in PCOD. So, PCOD and Prameha share common pathology because of the insulin resistance, and insulin resistance is nothing other than coming under Avarana. Avarana is the common factor.
Okay, okay. Then any results in diabetics, can you suggest?
See, I am not using, but the people are using Abra, people are using Yashada. Yashada and Abra related preparations are widely used, but in my practice, I am using more herbal medicines only, but Abra and Yashada both are indicated in diabetic management. And even Silajadu, of course.
Okay. Then in the Prameha Chilsa, patients get more result in for the fasting blood result, but in the postprandial it is not that effective. Can you suggest any reason for
that? We have some studies in post-prandial blood glucose level. Definitely the Datogini should be elevated. Most of the drugs which we are giving in Prameha is to only decrease the sugar value, but try to empower the Datogini with another medicine. These Datogini enhancing medicines need not be a diabetic medicine. Then you can see the difference.
Is foot drop is reversible?
Difficulty is there when the crisis is very much advanced, but Mahasneha indicated for Abhyanga, Mahasneha internally with a very good diabetic control, we can maintain the status. It is not totally reversible, but definitely the functional domain can be preserved. Chronic Vada Vyadhi Chikitsa, Mahasneha internally, Mahasneha externally with certain vastis can definitely strengthen the patient, and it can prevent further Mamsa Shosha.
Any modern comparison for Kleda?
Kleda, you can see Mutra se Kleda Vahanam. In my opinion, if you are getting more creatinine in Mutra, that is Kleda. Anything which is unwanted present in the normal urine, which is cleared through the Mutra se Kleda Vahanam, presence of creatine, presence of any such a thing in the Mutravaka Srodhas, or presence of anything through the Mutra, increased turbidity, albumin, everything can be considered under Kleda.
Okay. When to use Vasanta Kusuma?
I told you, I am not that much using mineral drugs.
Okay, then one last question. There are many questions. I selected few of the lighter questions.
General questions to my WhatsApp number later also.
We can do that later. Last question is Chikitsa of hypertension and diabetes.
See, that is commonly contributory. You have to do Mutra Virejaniya drugs. You very well know in modern medicine is also diuretic treatments are there. We can control the both. And when you are giving the Punarnavadi Kashayam, etc., it is Mutra Virejaniyam, anti-hypertensive, and it is very good renal protective. So you can think about treatments which are common to both. In the modern angle, in the Ayurvedic angle, Vadanilomana Chikitsa is mandatory. In hypertension, Vadanilomana Chikitsa is mandatory. Periodical Virejana, Dashamula Haridagi, etc., Haridagi preparations, etc., is very good. So ultimately, Vadanilomada will improve the insulin efficacy, insulin sensitivity, and Vadanilomada will control the hypertension also. Haridagi preparations, Punavadi preparations, Dashamula Haridagi, etc., are the some of the examples.
Okay. So that's all the question, but later we can connect with Dr. Gopumar through WhatsApp. We'll get it done through the WhatsApp. So thank you, Dr. Gopumar, for this presentation and your presence. This is the third talk in this series, and you have been associating with us and helping us in many ways, and we are very thankful for your support always.
Thank you, sir.
We look forward for more webinar with you again, and also physical meeting is not possible. We also look forward for that. So anyway, we will conclude this webinar. Thank you all the participants for taking time, especially everybody was looking forward for Dr. Govimar's presentation. Thank you for participating in the webinar. And I also would like to thank the organizers, like Dr. Danya, who has hosted and done a lot of work for this webinar, and the IT team, Manigandan and Sumesh for supporting, and Senthil all the background for with us always. So thank you all. Thank you all the participants. Once again, thank you, Govuma.
Sir, okay, sir. Thank you to you. Thanks to you. Thank to Danya madam. She coordinated very well. Even from the selection of the topic till now, she was rightly doing everything. Special thanks to Danya madam and all the technical people. And above all, very much thanks to all the listeners, all my beloved students, practitioners, friends, teachers who attended this program. Without your active cooperation, there is nothing in seminar. So learn Ayurveda, love Ayurveda, live Ayurveda. We have to treat millions of diabetic complications. Thank you. Thank you very much. Good night.
Thank you very much. Good night. Bye to all of you. We'll meet in the next webinar session. Thank you. Thank you.